Now, today, the state of Indiana reported 2,700 new cases of COVID. So look at this graph and you can see the trend there on the right-hand side of your screen going up where this is the 7-day average. It continues to climb and it's doing so quickly.
Yeah, this all comes as COVID cases and quarantine spike through schools all over central Indiana. In fact, some school districts are making a change to try and slow the spread.
Tonight, Rich Nye takes us to the west side in Brownsburg, where they're hoping that masks can help keep more of the students there in the classroom.
The line for COVID testing stretched about 100 vehicles deep Tuesday afternoon at Hendricks Regional Health Brownsburg Hospital, with many children on school quarantine getting tested.
She feels fine and everything, so I mean, we haven't had any concern. We just want to make sure everything, we have a big family. We want to make sure everyone is safe.
12-year-old Addison Miller waited 2 hours with her mom for a test. Addison was identified as a close contact of a positive case at Brownsburg East Middle School.
It feels frustrating because we haven't, I feel fine.
Addison is one of almost 1,200 kids in quarantine in Brownsburg schools. Close contacts identified from 77 confirmed COVID cases.
I am sick at my stomach every time I hit send on one of those messages. I am, because I know on the other end of that phone call is a parent who has to make immediate arrangements for something that they hadn't planned on that day.
Brownsburg Schools hopes to slow the spread of COVID and reduce the number of close contacts by once again requiring everyone to wear a mask inside school buildings starting Wednesday. Universal masking in school allows contact tracing to be reduced from 6 feet to 3 feet of an infected person with 15 minutes of exposure. Tracking where students were and who they were around and how long they are in quarantine is a huge task for schools.
It's daunting for a lot of people, but we think that it's so important to have kids in school with our amazing teachers and staff. And it's worth all the things that we're doing to try to keep kids in school. 100
students did not have to quarantine as close contacts because they provided proof of vaccination.
We're told the recommended quarantine is 14 days, but there, students without symptoms are allowed to come back after 10 days in Brownsburg. And students can return after 7 days if they have a negative COVID test result.
Now, all of this comes as doctors are warning this Delta strain that we talk so much about is spreading much more readily among children. The director of infection prevention over at Riley Hospital is telling us the number of kids in the ER with COVID has exploded.
A few months back, perhaps you would see, 20 children over a 2-week period. Right now, just looking at the numbers this morning, there's almost close to 60 in a matter of a week.
Yeah, Dr. Christensen went on to tell us one of the big concerns with kids spreading COVID is infecting adults who are much more likely to have severe complications and end up in the ICU.